Diabetes symptoms, type 1 diabetes symptoms, diabetes skin signs, and more. Diabetes may affect many regions of the body, including the skin. Some skin changes occur in the latter stages of diabetes, while others serve as early warning signs. In fact, skin issues are sometimes the earliest indication of diabetes. There are normally few skin lesions associated with diabetes, but some skin abnormalities are common and can affect anybody. Nevertheless, those with diabetes are more susceptible to them. Welcome to the Health Hub, where information meets motivation and wellness, creating more connected health tips to help people on their path to better health. In this video, we are going to talk about diabetes symptoms, type 1 diabetes symptoms. So let's discuss the signs one by one. Have you ever observed a dark patch or a band of velvety skin on the neck area in the back? This can also be observed in the armpit and groin regions. This disorder is usually observed in obese individuals. Its medical name is acanthosis nigricans, and it indicates a high blood glucose level. That could be the first indication of diabetes. If you observe such skin changes, consult your physician. Detecting diabetes early can avert numerous issues in the future. Blisters can suddenly form on the skin of diabetics, although this occurrence is quite unusual. A huge blister, a cluster of blisters, or both may be present. The blisters typically occur on the hands, feet, legs, and forearms and resemble blisters caused by severe burns. In contrast to blisters that result from a burn, these blisters are not unpleasant. You may also observe that the surrounding skin has a porcelain-like sheen and that the blood vessels are visible. This disorder is known medically as necrobiosis lipoidica. The skin is itchy and unpleasant, and the disease goes through cycles of being active, inactive, and then active again. If you observe this form of skin lesion, you should get diabetic testing. Next significant characteristic is skin tags. Numerous people have a few skin tags or skin growths, which is normal and harmless. However, this form of multiple skin tags with a blackish skin coloring may indicate excessive blood glucose levels. These growths occur most frequently on the eyelids, neck, armpits, and groin. Your skin has yellow, reddish, or brown spots. This skin ailment typically begins as little, solid, raised lumps that resemble pimples as they grow. These bumps transform into yellow, reddish, or brown areas of inflated, hardened skin. Long-term high blood sugar levels might result in poor circulation and nerve damage. Long-term uncontrolled diabetes may have contributed to this condition. Inadequate blood flow and nerve damage can make it difficult for the body to repair wounds. This is especially true with regards to the feet. These lesions are known as diabetic ulcers. If you are suffering from diabetes, you should inspect your feet daily for open sores or wounds. Diabetes is commonly associated with localized itching. Yeast infection, dry skin, or inadequate circulation may be the cause. When inadequate circulation is the cause of itching, the lower legs may be the itchiest. You may now be able to relieve itching on your own. Reduce the frequency of your baths, especially when the relative humidity is low, and use skin cream after each bath. Skin hardening or thickening is the next significant change. 1/3 of people with type 1 diabetes have digital sclerosis, which is characterized by thick, waxy skin on the back of the hands. The finger joints become stiff and difficult to move. This skin condition can also affect the toes and the forehead. Knees, ankles, and elbows may occasionally stiffen. In this case, blood glucose control and physical therapy may be beneficial. This skin condition that causes spots that are barely visible and can be softened with moisturizer. Depressive skin conditions. The medical term for this condition is diabetic dermopathy, and it generally appears on the shins of diabetics. Rarely, it appears on the arms, thighs, trunk, and other parts of the body. Because the spot does not create any symptoms, many individuals mistake it for 8 spots. Unlike 8 spots, however, these spots and lines typically begins to fade between 18 and 24 months later. Furthermore, diabetic dermopathy might remain on the skin. Erythroxanthematosis is frequently observed in uncontrolled diabetes, and when these bumps emerge, they frequently resemble acne. Unlike acne, these lumps develop a yellowish hue rapidly and are typically found on the buttocks and thighs, backs of the knees, or the crooks of the elbows. But regardless of where they form, they are typically painful and irritating. The rapid disappearance of these yellow bumps indicates that the patient's diabetes is well controlled. Skin infections are usually related with diabetes. It could be bacterial or fungal. Common bacterial infections in diabetics include stys, an infection of the glands of the eyelid, and folliculitis, an infection of the hair follicle. Carbon infections of the skin and underlying tissue caused by fungi are also common in people with diabetes. It is especially prevalent in warm, moist skin folds such as under the breast, between the fingers and toes, at the corners of the mouth, in the armpits, and in the crotch. Itchy fungal infections include jock itch, athlete's foot ringworm, and itchy vaginal infections. In conclusion, if you observe any of the above-mentioned symptoms, it is crucial that you connect them with additional risk factors such as obesity, a family history of diabetes, or a sedentary lifestyle. Having a single symptom cannot be directly associated with diabetes. It can also be related with other conditions. But if you're over 40 and in one of these high-risk groups, it is best to monitor your blood sugar regularly. Many future complications can be avoided by using oil in the detection of diabetes and as a precautionary measure. Hopefully this video has answered a couple of questions. Thanks for watching. If you enjoyed, please give us a like, subscribe, and comment for more health tips.